Mental disorders are common. Look at conditions like depression and anxiety. More than 300 million people across the world suffer from these disorders. And so it is very important for mental disorders to be diagnosed by every healthcare provider, not only by specialists. So it occupies a very special position in the diagnostic categories so that these disorders can be identified early and treated, which is what WHO's objective is. And for this reason, the development of the mental disorder chapter in ICD has involved a number of languages, a number of regions, and actual field testing in a variety of countries, just to see to it that the best foot is put forward for proper diagnosis in spite of some regional and cultural variations. The ICD categories for mental disorders have been simplified, and the diagnostic descriptions have been put in so that they are easily understood and easily applied by any healthcare provider, whether it's a doctor or a nurse or any other person. These people can understand and apply it very easily, because for mental disorders, the treatment gap is very high. Out of 100 people who suffer from mental disorders, on an average, 70 to 80 do not receive any treatment. So WHO's objective is to simplify the procedure so that every healthcare provider can easily identify and treat these, which will be decreasing the burden of these disorders, which is extremely high. ICD-11 is a diagnostic classification which should cover common disorders as well as uncommon disorders. So I referred to depression and anxiety being very common. Gaming disorders are uncommon, but is still very important. ICD has to keep pace with the evolving disorders and diseases, and here is one of them. Do remember that gambling disorder was included in ICD-10, but gaming has now been added because of very clear scientific evidence that it has characteristic signs and symptoms, and there is need and demand for treatment from many regions of the world. So that's why it has been inserted, and obviously this will help people to become more aware about this entity and also seek and get treatment. But let me just add that everybody who indulges in gaming from time to time doesn't have this disorder. In fact, it's only a minority of people who game who will satisfy the strict criteria for gaming disorder in ICD-11.